Globally, the population aged 65 years and over is growing faster than all other age groups. By 2050, 1 in 6 people will be in this subpopulation, increasing from 1 in 11 in 2019. The need to promote and improve healthy aging globally has never been more urgent. Actions to foster healthy aging can enhance older people's health and well-being, ability to contribute to their communities, and ensure they are able to do what they have reason to value. Most deaths from respiratory viruses occur in older adults, with the risk of infection and adverse consequences increasing drastically with advancing age. Age-related deterioration of the immune system, known as immunosenescence, and the prevalence of non-communicable diseases, including lung disease, heart disease, and diabetes, increases the risk of infectious diseases with severe outcomes, such as hospitalization, long-term consequences, or even deaths for older adults. The growing number of individuals at risk of contracting infectious respiratory diseases calls for concerted actions to protect the function and quality of life of older people globally. In this podcast, we explore a respiratory virus that doctors have described as one of the most important viruses you've never heard of, human metapneumovirus, or hMPV. My name is Katrina Bazanis, and I'm the Director of Policy Advocacy and Innovation at the International Federation on Aging. Join me, along with esteemed experts, in a dialogue which seeks to raise awareness of hMPV and discuss measures that we can take to protect ourselves and support our health. Welcome to the first episode of hMPV, a common yet unknown respiratory threat. Let's dive into today's conversation with Dr. Peter Openshaw. Firstly, Dr. Openshaw, I'm wondering if you can introduce yourself and tell us a little bit about yourself in your own words and your role and your expertise.
Well, thank you very much indeed for asking me to come and talk to you about human metapneumovirus, which is a bit of a mouthful to say, but actually is a very important virus, I think, under-recognized. So my own background is that I'm a pulmonologist, a physician who looks after people with lung disease. But I've been working on lung viruses and their role in lung disease for about 40 years now. So I've seen the arrival of many viruses, including human metapneumovirus, on the scene. I guess, my expertise is really in the development of vaccines and in respiratory viral immunology. That's my special area of interest.
Yeah, thank you so much for sharing that. And we're hoping to delve into that in today's conversation. All right, so we'll kick things off. As you mentioned, this podcast is about human metapneumovirus. So can you tell us a little bit about what is hMPV?
So human metapneumovirus, it was unknown until 2001. It was discovered by investigators in the Netherlands who were looking at the presence of different viruses, and they had a lot of expertise in studying viruses in birds. And in birds, we've known for some time that there's been a virus around called avian metapneumovirus, and they found something actually remarkably similar in humans. So they called it the human metapneumovirus. So we've only known about it for less than a quarter of a century. So one of the latecomers, really, in terms of what we know about viruses that cause respiratory disease. It's often compared, really, to another hard-to-pronounce virus called respiratory syncytial virus, or RSV. So RSV is a virus that I've worked on for a very long time and has been particularly important, not only as a cause of bronchiolitis in babies, wheezy lung infection in babies, but also increasingly over the past few years has been recognized as a very important pathogen in older adults, particularly those who are frail and those who are living in community settings. And really, human metapneumovirus fits into that sort of pattern. Tends to be a little bit older when it first infects children, and it tends to be a little bit later in the season. And I think its importance in human older frail adults has been underappreciated. I think it's increasingly recognized as an important pathogen. Now that we've got vaccines for RSV, which perhaps many people who are listening to this podcast will be aware of, human metapneumovirus is really one of the next ones in the pipeline in terms of viruses that we need to protect against if we are going to reduce the winter burden of respiratory disease in older adults. So I think it really is one in terms of the imminent development of vaccines.
So can you tell us a little bit more about, how hMPV spreads and the contagious aspect of the disease?
Okay. The way in which human metapneumovirus spreads has not been very extensively studied, but there certainly do appear to be outbreaks, particularly in institutional settings where there are high concentrations of people with frail elderly people with pre-existing lung disease. But it certainly spreads in domestically. It often may be transmitted from a child or grandchild who is in the home, and then spreads typically to the older adults and causes particularly bad disease in those frail elderly adults who are in those communities.
Yeah, thank you so much. So, how would you describe sort of the symptoms? We know it's a respiratory disease and it's, potentially very similar to other respiratory diseases that, the audience may be familiar with. But can you share a little bit about, do they differ? Are they the same from other respiratory diseases that we may know about?
So the spectrum of disease that human metapneumovirus causes is quite similar to many other viruses, particularly to respiratory syncytial virus. So it tends to start off as a common cold, and then may proceed to causing lower respiratory symptoms with persistent cough, maybe sputum production, and then subsequently, in some people, a deterioration of their existing heart and lung disease, and may present as an influenza-like illness, but less often with fever than with, say, influenza. Influenza tends to cause more febrile illness, whereas human metapneumovirus is actually quite similar in many ways to RSV in older adults.
And, how long would you say that infections typically last? And, do we know what the recovery process looks like or what the treatment would look like for hMPV?
Well, I mean, the incubation period is usually between 3 and 6 days. So it's a relatively prolonged incubation compared to influenza. It often starts with these mild common cold symptoms, and then followed by the complications that are seen in the lung, and also deterioration in existing heart disease. And those are perhaps the more serious complications of the infection with metapneumovirus. So the actual disease course can be quite prolonged, and it can be quite hard to identify that it was actually human metapneumovirus that triggered the chain of events which has led to a deterioration in these older adults in particular. So it can be quite an insidious and often hidden virus, because the virus has disappeared as a common cold agent and is no longer present in the upper respiratory tract by the time a person presents with a deterioration in their physical health, and may be admitted to hospital.
Yeah, so that kind of leads me to my next question around diagnosis. So, is it difficult to diagnose? I mean, you've kind of mentioned that, but how often are people really being diagnosed? And is this something, if you were to come in with your average respiratory disease, is this something that would be diagnosed in an older person?
I think it's frustrating to many of us who work in this area that it's quite infrequent to actually be able to diagnose the presence or absence of a particular virus, especially in somebody who has perhaps already been ill for several weeks, following a common cold. And what they're presenting with are the sort of late complications when the cold has gone to their chest, as you might say, and perhaps they've already had a course of antibiotics at home, and then they're admitted. By that time, it's really hard to be able to try to identify the virus that triggered it. I mean, we do have these rapid multiplex diagnostics, as they're called, so based on use of PCR machines that can be used, especially for, say, younger people or for children with their first infections. Quite often you do get a positive result, but in older, it really can be very hard to know what it was that caused the deterioration, because the actual infection in the nose, which is where you take the swab from, has been gone and went, as you might say. It's in the past. Whereas what we are presented with in the clinic with more severe disease are the late consequences of these infections, by which time the virus is very hard to actually diagnose.
And, I guess my a follow-up question is your average kind of healthcare provider actually even, taking swabs, or are they, given that the treatment is very similar for many of these kind of respiratory diseases?
I think you're making a very, very good point there, that actually we don't at the moment have specific treatments that depend on making a diagnosis. And therefore, many healthcare providers and many healthcare funders will actually discourage the use of these expensive multiplex diagnostics, because they'll say, well, it's not going to change your treatment, so don't do it. It's just a waste of money. I mean, I've always found it very reassuring to be able to positively identify a virus and to be able to tell somebody and their relatives what it is they have. And it has been shown that it reduces the unnecessary use of antibiotics if you are able to specifically identify a virus. In research terms, it's absolutely vital that we know which virus is causing deteriorations, because that incentivizes the development of vaccines. Unless we actually can work out which viruses it's important to prevent, then there's very little incentive to invest in making vaccines and other ways of preventing these infections. So I think it is quite vital that we do know, but not necessarily essential for every case of a person who's presenting with an upper respiratory infection which has descended to the chest.
Yeah, thank you. Yeah, I think that's a very important point for, the broader public health implications of the disease and understanding kind of the burden of the disease. So I want to ask, you've mentioned, older adults are at risk for this disease, but can you share a little bit more on who is most at risk of contracting hMPV and what factors might make them at risk?
Okay. So the importance of hMPV was first really discovered and emphasized in children, and often it was children maybe in their second or third year of life. More recently, there have been quite a large number of studies done to try and identify human metapneumovirus in older adults, and the results are patchy. There are studies that show it to be probably the second or third most important, even studies showing that in a particular season, in a particular location, it's the most important in terms of causing deterioration of existing heart and lung disease. But it does vary from place to place. So it's quite hard to be specific in a particular location whether this season is going to be a bad one in terms of human metapneumovirus. I think it's possible that we could be developing vaccines which would protect against a number of different pathogens, and metapneumovirus would be up there alongside or next to RSV in terms of a vaccine that we'd like to develop. Mm-hmm. So vaccines which are going to be protective against a number of different pathogens could be really, really important in the future.
And do we have kind of any understanding of the burden of disease regarding hMPV? So, the prevalence among key groups or anything like that?
Well, so there have been a number of different clinical studies, and it does tend to vary. Amongst some of the publications, you don't know whether these are rather selected publications. It does appear that that metapneumovirus is maybe as important as influenza. I would say that in general, influenza and RSV are the most important viruses, and that this would be a sort of third order virus in terms of the importance in older adults. But of course, as we become better at preventing influenza and better at preventing RSV with pretty effective vaccines really for both, then the importance of human metapneumovirus will become greater. because the balance of disease will shift.
Yeah, I think it's an interesting point that, you've named it as, one of the top diseases, but I think, there's quite a lot of awareness on influenza, but maybe not so much on this disease. So can you maybe, and we've touched on it in your previous answers, but broadly kind of why is this disease of concern and what do we know about, some of the long-term impacts that this disease might have on an older person's health?
This is really quite a new virus in terms of our awareness of it. And the studies that have been done in terms of long-term health impact are really only in their infancy. I think there's a lot more research needed into this, but it's, I think, very clear that it will become a much more important cause of heart and lung deterioration in those with pre-existing disease as we manage to prevent a lot more cases of RSV and influenza. So I think it is very much a virus for the future.
Mm-hmm.
I mean, just to reflect on why it's so little known, I think that's partly because it's only really been within the past, 24 years or so, that 23 years that this virus has been known about at all. And we focused on RSV and influenza rather than trying to characterize metapneumovirus. I would also say that it's a pretty cumbersome name. Everyone can recognize the term flu or influenza. That's very easy. Everyone knows about it. Everyone knows it's important. By the time we get to respiratory syncytial virus, that's pretty unknown. There is a greater public awareness now than there was, but it's hard to get your tongue around it. And then we've got the metapneumovirus and other viruses coming up behind, most of which were named by academic virologists in a way that doesn't easily trip off the tongue. So I would say that in terms of public awareness, these are pretty disastrous terms that have been chosen for these viruses.
As we wrap up our conversation, we're in the midst of respiratory disease season in the Northern Hemisphere, at least. So, do you have any recommendations or precautions as we go into this season and people may be thinking about hMPV? What can people do if they have suspicions of this or if they want to learn more?
I think the first thing I would say is that measures to try to keep ourselves free of winter viruses can be very general. So we know that that keeping your distance, meeting people out of doors, wearing a mask, that sort of thing does work. And unfortunately, as an older adult, one of the things I most look forward to is hugging my grandchildren. And that's obviously something which, if you do have a very significant pre-existing heart or lung disease, that you should probably greet them from a slight distance, particularly if they've got runny noses and they're coughing and sneezing. Very hard advice to follow.
Mm-hmm.
I mean, in terms of protection, we do have existing, vaccines which are really, really excellent, which do work for both influenza and for RSV. And I think this is something which is on the horizon, that we're hoping that we're going to have vaccines for human metapneumovirus and maybe para-influenza, these other viruses. If we could add this into a mixed vaccine, which is going to prevent many winter viruses, I think people would quickly recognize that the vaccines that they're getting are protecting them in a much broader sense than just against one or two different cold viruses.
And then, finally, is there any other key messages or key takeaways that you'd like to add from our conversation today?
I think maybe, just to say we all have to try and enjoy life and get some fresh air and sunlight. And fresh air and sunlight are the enemies of respiratory viruses.
That's great. Thank you so much, Dr. Openshaw, and a real pleasure to speak with you on this. So a huge thank you.
It's a pleasure.
And thank you to you all for listening. As Dr. Openshaw has addressed in today's episode, hMPV is a serious respiratory virus that can heavily impact older adults among other at-risk populations. hMPV shares many common symptoms and long-term impacts, as well as similar burden and mortality rates with better-known respiratory diseases such as RSV. Furthermore, for those with pre-existing conditions, hMPV may lead to deterioration of heart and lung health. Dr. Openshaw's advice to take precautions as done for other respiratory diseases, such as washing our hands and wearing masks in congested places while balancing social and mental well-being, is key to staying safe and healthy. Tune in to episode 2, which will share a person-centered lens on hMPV while featuring both patient and healthcare provider perspectives. IFA would like to thank Sanofi for supporting this series. To find more information on this episode and view associated resources, visit vaccinesforlife.com. To join the conversation and continue the dialogue on hMPV, follow, like, and engage with us on social media.